And next, coming up, we have Dr. Alex Lynn with us, and he is a neurologist from Australia. And we'll see if we can pull up, we may have to give him just a minute as he gets a chance to turn on his screen, and we'll unmute him so he can, there we go. Thank you for being here with us.
Good morning, everybody.
Thank you. Can you go ahead and tell us a little bit about yourself?
Yeah, of course. Good morning, everybody. I'm what they call a Ger-Australian. I'm really a German by nature, but found a Kiwi wife and have lived in Australia now for 14 years. I'm a movement disorder neurologist by training, so I run the movement disorder service at my local hospital and have a keen interest in functional disorders. And long and painful story, but used to run a multidisciplinary public FND clinic here at our hospital until we lost funding for that, sadly, a few years ago. And we're desperately working on restarting some public service again. We will see. Maybe I've got better news for you next year.
I do hope. We know that you did a lot of amazing things with that program, and
it makes it hurt more than when it goes. Just the way it is.
You know, unfortunately, that is the nature of healthcare and the way some things work, and FNDs in that realm, just like other illnesses are, I'm sure. So, but you do
not
still
many pharma companies pumping money into that area.
Yes, well, and we're all working on getting more money in that area too. But you do still see patients.
Yep. So I still So I work privately for 1.5 days a week, and really largely what I see there nowadays is FND as well, which is great. And lots of people, hopefully we can still help well with it. And basically we kept our old team largely together. So we basically run the same service now privately, which works well. But I still think we need more public services, which is something we have to work on.
Definitely, and definitely some of the advocacy work of teaching people about FND and educating them, which is some of the work that you've been doing with some videos and things that you've created. Why don't you go ahead and I know you had some slides that you wanted to share with us.
Yes, I've got, because I thought yesterday about what I really want to talk, and actually the last 10 minutes of your discussion, which is very sad to hear, but I guess we all see those things, those really scarring and hurtful interactions patients with FND often have with health professionals. I thought it might help the community to learn a bit more about that, to learn why that is the case, why doctors react the way they do, and what my thoughts are about that, and the evidence we find behind that, and also what we think you can do about that. And we talk about the videos at the very end, more for patient education. So I need to go to share screen, don't I? Let's have a look at that. Try this. Oh, desktop one.
Maybe at the bottom.
Oh, I need to allow my system. I'll zoom, here you go. Okay. Oh, sorry. I very quickly have to quit apparently to allow Zoom to do this. So I will be back in just 1 second, okay? You keep talking, Bridget. Keep talking.
Well, let's see. They did threaten that I'd have to sing if we had a lull, but I won't do that. Perhaps some of the things I think, as Dr. Len had mentioned, is kind of this difference of what doctors know and understand, and maybe where some of that bias is coming from. We recently have been working on a paper with Dr. Karen Rommelfinger and through the Emory program on bias, and some of that in discussing and looking at research into the bias of medical professionals and patients. So I think when that paper comes out, it'll be a very good thing to.
Bridget, I think I'm back in action.
So, thank you, and we have you back, and so
Perfect.
We'll let you take it from here. Thank you.
And can you see my slides now? Can you see that screen?
You can see your slides.
Perfect.
Yes, and we can still see you.
How much time do I have, Bridget, roughly?
Until the end of the hour.
Easy.
So we're all in different time zones.
Fast talker, as you might have realized.
Yeah, you're in a different day and a different time zone. So
I
the
know.
top hour, and if you want to go over, whoever wants to stick around is
Okay. I'll
welcome
just
to.
start talking. And please, everybody, feel free to chip in between and ask questions if you have. So there's not just kind of, it's always weird when you just talk against a computer with those kind of things. But as I said, so I just wanted to give you some ideas about why doctors are the way they are. And I don't want to excuse that at all, but I think it helps us to understand why people react certain ways. And that hopefully helps us as well then as a community to work on these kind of things in the future. So we had a lot of thoughts about why do those things occur? And we all see that this kind of palming off patients, not listening to patients, ridiculing patients, and what I heard before, and kind of this amazing fixation on, oh, just all in your head, go away again, I don't want to listen to anything else. And in our opinion, there's a lot of secret fears that I guess all of us human beings have, but I would like to think most health professionals are human beings as well. They certainly have as well, and they often don't admit to, but I think they can explain a lot of these types of reactions amongst people. So I just want to quickly run you through, that's a study we published last year about just that. So, and we wanted to somehow get through to these secret fears that otherwise people, when you talk to them directly, they would rarely admit to, because of course they don't want to admit that they don't know things, and doctors often don't want to admit weakness and all these things. So we thought we'd do an anonymous survey by a SurveyMonkey to literally all health professionals involved in care of FND patients. So that's general practitioners, physiotherapists, psychologists, occupational therapists, psychiatrists, psychologists, neurologists. So the lot. We really did a whole blast of invitations to health professionals in Australia and New Zealand of people dealing with patients with FND. And we had a total of 538 responses. So a good number of people to kind of get some information from. And if you can look at this here, so there's a few key areas we really wanted to dig into, what people think about their knowledge and training, get a few ideas about attitudes of health professionals towards FND and their interest. I'm very interested in this confidence and communication. I think that's a real problem, that doctors have this amazing fear of explaining these issues to patients and discussing these issues. Then peer referral and support is something we think is a big issue as well. This feeling of being dumped on, this feeling of, oh, if I see those patients, they just get pumped off to me, like the neurologist just somehow gets them out of the door and dumps them onto me. I think it's a real problem. And that's something probably for the FND patients in the community here listening in, a hard thing to listen to, but I think it's important to call a spade as well. What negative experiences might people have had as health professionals in that area, and what has that led to in the future? And there's 4 real key questions we wanted to answer with that, and I'll just read them out to you. So 4 key questions we asked for every participant. One is to judge their knowledge of FND. One, to judge have they had adequate education about FND. One about how confident they are diagnosing FND, and how confident they are discussing the possibility of FND with the patient. So those 4 key things we really wanted to dig in a bit further. And the numbers were not surprising, but quite sobering. So this is something where across the board, we asked people about, have you received adequate education about FND? And only 14% of all health professionals. And this is already people with interest in that area, not just your random health professional off the street. 14% only of these health professionals said they received adequate education about FND. And the vast majority does not feel well educated. And I think it's a real issue, and it drives a lot of those problems that you as patients see with it later then. Similar with, I have a good knowledge about FND, not too bad amongst neurologists, but you can see GPs, general practitioners, 14% only report good knowledge. And the majority of nurses, physiotherapists, psychologists don't feel they have adequate knowledge about functional neurological disorders. Then if we do have some time, I'll give you my spin about things with that response from neurologists and psychiatrists, because I want to meet those 86% of neurologists that are confident discussing the possibility. In my experience, that's not the case, and maybe they're hidden away in some cave in Australia. and don't come out yet. I think these are probably more realistic numbers. Again, the majority of GPs and physios and a large number of nurses and psychologists don't feel confident with these discussions, and they're scared about it. And we looked into a bit further, kind of what drives change, and can we see, okay, amongst these groups, who were the ones that felt better and who were the ones that didn't feel as good? And certainly practice makes perfect. So participants in that survey who saw more patients with FND generally felt more confident with diagnosing FND and had reported greater knowledge, which was also related to kind of discussion with FND patients. And what's important as well, so seeing more patients is not the same as years of practice. So lots of the more senior people who participated didn't report that. So it really is related to seeing patients with FND. Just having years of experience does not make you a better health practitioner in regards to FND. There's a real gender gap, which I'm kind of on the wrong side of a gender gap, I have to say. So female health professionals generally report a significantly greater interest, but we're, I guess, more humble about their reporting of knowledge and communication confidence. But the interest was significantly larger amongst female health professionals compared to male health professionals. Old dogs and new tricks, I just alluded at it beforehand. So increasing age made people more confident, but also in that group, they had significantly less clinical interest in FND patients and more of a negative attitude towards FND. And I kind of have that feeling as well when I give talks to people. It sounds really sad, but I'm kind of largely given up on the older generation of neurologists. There was kind of, I feel like they're like, oh, what do you think, telling me how to deal with these patients? I've done this for the last 30 years. I don't need you to help me with that. So I think there are real issues with that group. Whereas in younger health practitioners, younger doctors, particularly our trainee registrars, I see a lot of interest in FND, and they really want to get it right, and they want to be good, and they're really keen to learn more about it. So I see a lot of hope in that area as well. This is a really tricky slide, but I kind of quickly talk you through it because we tried to combine a few things in that as well. So you can see there clinical interests, negative attitudes, and negative experiences as reported by those groups of health practitioners in comparison. And I won't bore you too much with the detail, but you see the worst negative attitudes amongst neurologists, GPs, and nurses, the worst reported negative experiences amongst neurologists and nurses, and the least clinical interest amongst neurologists, GPs, and nurses. So sadly, I have to say, me as a neurologist, I agree, that's my experience as well. I think GPs and neurologists are the hardest nuts to crack. I see a lot of keen interest amongst physios, a lot of interest amongst psychologists, psychiatrists. They're really keen to dig in and get involved. To find neurologists and GPs who are keen to get involved in FND care is really hard. And I think it's such a big issue because that's the really important front end of getting it right, getting a diagnosis right, getting things set up well, make sure patients understand it well, to set them up well for good outcomes afterwards is so important. And sadly, we see that's a real issue at the moment. And there's a few free text responses. I just picked 3 for you. I wanted to read out to you just to give you a bit more of a feel about it as well. So we asked all those participants, they're literally just on SurveyMonkey, could give us a few bits of free text response of thoughts they want to share. And they're not very positive, but I think, again, it's important to be realistic about that and see what are the issues that drive people. So this is from a neurologist, and I just read it out to you. If there was enough time for the consultation, then management of these patients would be easier, as it takes time to be thorough, time to discuss the condition adequately to gain trust, and perhaps over a few consultations before the patients trust you enough to have this diagnosis made. And I can completely see where this neurologist is coming from. This is issues in my private practice is great because I can choose, I can spend as much time as I want with a patient. In my public service, that is very hard. We have all overrun clinics, they're overbooked, and you're already kind of running an hour behind, and then you have a patient coming in with often complex stories as it is with FND. That can be really hard to deal with. And I don't have easy answers for that either. There clearly is an issue. And I think generally there is something as physicians we need to change our approach. So I work here in my private practice with 6 neurosurgeons. If I told them they're only allowed to spend the same amount of time for each surgery, that wouldn't work for them either. Clearly, some surgeries take half an hour, some surgeries take 5 hours. And that's just how it is. And we're like, no, every new patient gets 30 minutes. There's no change in it. I think there's some changes we will have to make to be more flexible with what time we give patients for clinics. But that's an issue at the moment. And that explains some of those behaviors that you as patients see. And as for nurse, patients can often be demanding and time-consuming. Absolutely. And that's the truth there. Patients with FND often have complex needs. And I just think the health system as it is at the moment is not set up well at all for patients with FND. And that's a real problem. And that drives a lot of those issues. These people that you see with the bad experiences they have, they're largely not evil people. They're frustrated with themselves. They're frustrated with the health services around them. And that drives a lot of those problems. And I guess that's true as well. That's from a general practitioner. There are few incentives in general practice to take these conditions on. And absolutely similar issue for certainly our GPs in Australia. They're not earning $1 million, and I assume it's the same in most other countries. They don't have time there. I think on average this is like 7 or 10 minutes per patient. That is really hard in those kind of really strict timeframes to have any sensible input for patients with FND. And so the incentives for the practitioners need to be changed as well. And then lastly, I think that's the last one I've got in there, and that's kind of more like the patient dumping I alluded to beforehand. Doctors/neurologists often avoid making such diagnoses and explaining to patients about their symptoms, which makes following treatment and education extremely difficult. And that's certainly something I see a lot as well, this kind of patient ping pong, just somehow get them off the clinic room and dump them off to a physio or to a psychologist. And I think it's such a shame not to be able to build up those networks of trust amongst health professionals as well. But that's certainly the experience by a lot of therapists, that they just have patients being dumped on them. So what can we do about it? So that's the negative side of the talk done, and we come to hopefully to the more positive end of things. And certainly what we see amongst patients, and that's why we spend so much time explaining the diagnosis to patients, because we want our patients to be part of the treating team. But I see the same amongst health professionals. Knowledge is power. And I think what we really need to do is educate those health professionals. So I just talk you through a few principles of our teaching that we do towards health professionals and what we've learned from that. And then I can show you some so far unpublished data from our outcomes from that as well. So we started probably 2 or 3 years ago to run FND masterclasses. And I'll tell you about the background of that as well. So initially, that's probably going back 5 years ago when I started our FND clinic. I was really keen to spread the word and educate health professionals about FND. So initially, I literally just invited myself to various groups and just said, look, can I give you a talk about FND and just explain to you what these things are and what these conditions are and principles about that. And much to my amazement, the interest was huge, absolutely huge. Like within months, people kept flooding in, asking for talks about FND. People are really keen to learn. But what people really stuck with, they're like, oh yeah, it's all great to hear the theory, but we want to hear what we can actually do for those patients. So more hands-on advice on what to do about it. So, okay, so we stepped it up. So we started doing like larger, like 3-hour evening talks. And I invited one of my physiotherapists and one of my psychologists in as well. So we had like, I gave an introductory talk about FND, and then the physio and psychologists gave talks about more like hands-on, what the therapists actually do for FND and what can be done, and some evidence behind it, and shared their knowledge. Then the feedback we got was like, oh, really great, really keen, but we want to learn more. We want to learn really in detail, what do we actually do? How do we actually approach it? How, for tricky patients, what are the little tips and tricks we can learn? So we thought, okay, step it up a notch further. So we started doing weekend FND masterclasses. So they're, I guess, geared at people with some experience in FND already, who already work in that area, but who really want to get high-level support, high-level evidence-based knowledge about that, and a bit more help with that. So they're 1.5-day weekend courses. We really try to keep it very safe for health professionals. And that's something, for example, Bridget, I'm keen to get your feedback about that as well. Not that rarely do I get requests from patients to see if they can participate in the masterclass as well. And not because I'm mean, but I always say no. And I say no for a reason as well. Because again, for you as patients, you probably don't appreciate how scared health professionals often are. And they will not be honest about these things if they're in non-safe environments. So people will not give you their honest fears and questions in non-safe environments. And that's the feedback we get again and again from larger talks with that. So they're very safe environments. So it's literally, as people walk in the door, we're like, okay, in here, what happens in here stays in here. You can ask all the stupid questions you never dared asking, let it all out. So we really want to hit that hard. They're very small groups. So we have like 20 to 25 participants per masterclass and 6 faculty from us. So we have our whole team in there to really teach them. So proper hands-on teaching. We have simulation-based learning, and that's something you might wonder why I've got this tennis player in there. One of our educators always keeps saying, it's much easier to watch tennis than to play tennis. And that's so true. So you can read articles about how to discuss diagnosis about FND, and you can have all the experts telling you something, John Stone doing his talks and Mark Edwards doing his talks about how to explain a diagnosis. But unless you actually practice it yourself, you will not get there. So we actually have trained actors that we get in there where people can practice explaining and discussing the diagnosis of FND. And we can make the actors as well more and less difficult. We can make them really nice and easy, and we can make them angry, like frustrated from all the negative experiences they had beforehand. But we think that's really helpful to have that hands-on sessions for practice. And the last thing is with what I said there, with those small interprofessional groups, what we really think is important is this cross-pollination, that the neurologist or the GP who sees a patient not just randomly sends, oh yeah, we send you through to this psychology thing. No, but he actually knows what the psychologist will do with the patient. What are the principles behind psychological therapy for FND? And he actually knows what the physio will do with that patient, and between psychology and physio. So this cross-pollination we think is super important as well. So there's a few features that we do for what we want to achieve in the masterclasses. We really want to have up-to-date knowledge bases, and that's something I'm amazed again and again when I talk to other doctors. They're like, oh, there is no evidence for therapy and for FND anyway. Like, oh my God, have you lived in the 18th century? Like, so much data out there already. Not enough by all means, but so much stuff out there already. And to be able to get it across to people like, look, okay, this is current 2020 evidence base now. We found very helpful. Teamwork and cross-pollination, I already alluded to. The understanding why it's so important to get right, I think, is a really important part as well. So for every masterclass, we invite one of our patients to share his or her story. And I tell you, no eye stays dry during that. And we find it's really important because it's all great to have you experts there and giving professional talks, but actually having a patient sitting in there that shares his or her story about how it felt to develop these symptoms, how it felt to just be palmed off and ridiculed and sent home again and not listened to, and how much it can help to actually finally get an answer, understand what's going on, get some help, have people that work together well, communicate well, not only between doctor and patient, but between a team, what difference that makes and why that is so important to get that right. We feel is super important, and it's a real core piece of the masterclass that we do. Putting into practice, I already mentioned beforehand, so that learning with actors we think is super important. And a lot of what we do is very case-based discussion. And we, in the later stage of the masterclass, we actually ask people beforehand to bring in tricky cases they struggled with, and we discuss together how these can be approached. And very much so we use that masterclass to develop a network of health practitioners. So within Australia, we developed a network of really anyone's allowed in there, anyone with interest in FND. But the idea with that is to really stop this kind of patient ping pong and patient dumping. That if you then, let's say, a neurologist in Melbourne and diagnose a patient with FND, then you know, okay, these psychiatrists, psychologists, physiotherapists, these have an interest in FND. I know they know what they're doing with those patients. It's not the first FND patient they're seeing, but also for that psychologist or physiotherapist who is in a network, he knows as well that patient will not just be dumped on them. The patient has received the diagnosis, this diagnosis has been explained to the patient, and if there are issues, I can communicate back to the referring doctor and work in a team approach with that doctor. And we think that's really important for good outcomes. And slowly, but it has grown a lot, this network. So I think on our network database now, we've got 96 people on there, which for Australia is a lot. So that number was 0 like 3 years ago. So it's nice to see that growing. So I just wanted to show you as well, how much difference does it actually make? So again, we wanted to be as honest as we can. So all the participants for the masterclass had anonymously on SurveyMonkey questionnaires before the masterclass and straight after the masterclass. And again, with similar questions I showed you beforehand that we're really interested in. Do we actually help make a difference with that? But what I think actually is particularly, so you see that pre, it's just before the masterclass, post is immediately after, and then long term is, so we emailed out in 6 months after the masterclass and said, okay, people, now that you've been out in the community, you've done your thing, we want to have those answers again to see not only do they feel better after, straight after do it, but once you put it into practice, do you actually still find these helpful? Have you actually changed your practice? And I think that's by far the most important part, because you can't help, even although it is anonymously, maybe people just want to be nice to us and kind of say, oh yes, was so great, really happy with everything, learned so much. But for us, the really important part was the anonymous follow-up, 6-month follow-up to see, has what they've learned actually changed their clinical practice. And I think 3 or 4 of the outcomes in there to give you an idea about that. So this is, I'm confident understanding functional disorders, pathogenesis, underlying mechanisms, and treatment strategies. So that's kind of the really scientific, do I really understand where are we with current evidence, understanding about FND was quite poor about before the masterclass. So keep in mind, so this is again, a very pre-selected group. So these are already people with interest in FND who already work in an area, not just your random therapist off the street. But only 41% before the masterclass reported confidence in these areas, nearly 100% post. And what we're really happy about is, so this is then anonymously 6 months later, just via email, another survey that held up very well on long-term follow-up afterwards. Even more exciting are these things. So this is, I'm confident, discussing the possibility of FND with the patient and still being able to maintain an effective relationship. Again, only half of participants beforehand, the vast majority after. And this is after then practice runs for another 6 months when they actually put it into practice. 100% of participants at the end were like, no, it's cool, we've got this now. We really feel comfortable with it now. So that outcome got us very excited. I'll just show you, I think, 1 more, 2 more. I'm confident in recognizing positive clinical signs, and I think we all agree. What we really want to move away from is this kind of diagnosis of exclusion, but really get people, doctors and therapists, be comfortable in recognizing positive signs so they can look for it, assess as such, and then also explain that to patients and make sure we all, health professionals and patients, are comfortable with the diagnosis when it occurs. Only 42% pre, 80% post. And what's really exciting, again, as people practicing and actually put that, what they learned into practice 6 months later, 94.4% were comfortable in recognizing those signs. And that's really across the board. I'm not expecting a psychologist to make a diagnosis of a functional movement disorder, for example. But I think it really helps if all of us who work in that area at least comfortable about these signs, and then maybe be able to reinforce if there's issues with understanding, or explain again if there's issue with explanation beforehand. So I think all of us who are involved in the area be confident with that really still does help. And so this is something, just a glimpse about outcomes we saw from that. Hopefully it's going to be published soon. We unfortunately got rejected from a few journals, and hopefully I just submitted it again last week to another journal. So you might see the full outcome summary of that hopefully soon published somewhere. The other thing we worked on, how are we with time? Not too bad. So hopefully we've got 5 minutes or so at the end for discussions as well, is we also wanted to reach out to patients and families more. And I guess similar to the thoughts that are behind John Stone's Neurosymptoms website, it's like there's only so many people that can come and see me and I can explain the diagnosis. So how do we reach out to people from far away to explain principles of FND, principles of pathogenesis and treatment of FND to people? That was one thought. And the other thought was, well, maybe we need to go more next generation. I'm possibly the last person in Australia who's not on Twitter nor on Facebook, but I'm well aware that younger people, the way they get their information is not with boring printouts and brochures. The way they do things is via social media and with videos and YouTube and TikTok and all these kind of things. So we produced 5 videos about FND, and there's nothing, nothing fancy to it really. We try to keep them short, very much to the point, but we really wanted to get straight to people about a few key points we wanted to get out, and hopefully that's something people can spread for whatever platforms they found helpful. And I'll just show you one of the videos. Bridget, will sound work with that as well if I start now?
It should. Hopefully.
Okay, if it doesn't, you just wave, okay? I just started now, okay? Yeah. That's one of the videos we got there.
What are functional neurological disorders? Think of your brain like a computer. In this computer, there is hardware or cable work, and there is software. The brain software controls how your brain communicates with itself, with the outside world, and also the body. Functional neurological disorders, or FND, are like glitches of the software part of the brain. This can cause a variety of symptoms. Common problems in patients with FND are episodes of altered or loss of consciousness, which are called dissociative attacks. They can look like epileptic seizures, but are not due to abnormal electrical activity in the brain. Functional movement disorders can cause difficulty with walking, tremors, so uncontrollable shaking or weakness, and sometimes even whole body paralysis. There are other types of functional symptoms, including dizziness, sensory problems, speech disturbances, and cognitive symptoms. Literally every function that is controlled by the brain can be affected. It can even cause problems with bladder and bowel function. Functional neurological disorders are genuine disorders that cause real symptoms. The good news is that these disorders are treatable and many patients can improve.
So that's the first of a few videos that we have on there. And it's nothing too fancy to it, but what we try to get is kind of get connection between health professionals and patients as well. So that's hopefully something any GP, any general neurologist, and general psychiatrist can use then to explain a few principles about that, and hopefully for patients as well, if they pick it up, they come back to the doctor with it. So all of those are available on our FND Australia website. So no www, just fndaustralia.com.au. And you can watch them on there, you can download them as well. So please feel free to use them for whatever you want to use them.
Oh, thank you. I took it off. If you're ready to answer some questions, or if you need to
go perfect, yes. Hang on. I have to go to video now, do I? Here you go. Hello.
I was going to say, we can still see you. It might change on how you see.
Yes.
One question I had on the first part that you spoke about the study, was that strictly done in Australia, or was that an international study?
Purely Australia. And I made a point of that as well, because there is similar studies done elsewhere in the world. And look, if you look at them, the picture is the same everywhere. But as you know, what we see more and more, we're desperate to get some funding off the ground, get something from the government. And the questions we always get like, well, we don't know how it's here. We don't have any data for Australia. So I think in all our countries, we need international data, but we need to produce good quality data in our countries to actually show the size of the problem, because otherwise we'll never get any decent government funding for any of these issues. So yeah, this is purely in Australia, but for a reason, because I wanted to show these problems are the same in Australia as they are elsewhere in the world.
But as you mentioned, the numbers look very close to similar studies that have been done on the same. kind of different questions, but basically the same question, just kind of
Yep.
worded differently. And those are typically the responses. I was kind of mentioned in that time while you were getting ready, we actually referenced this paper that you're
Right.
talking about in a research agenda that we're creating through an international collaboration as well, because the bias and stigma is a really important part of all of the dynamics that are going on and the obstacles that patients are encountering. So we really appreciate that you've discussed that in your talk today. There's a couple questions that people also had regarding, I'm trying to get to the top because I keep scrolling through. As far as like the master classes, are those available still, and where would someone find out about those if they're interested?
Yeah, so I guess with part of our FND clinic being, what do I use as a PC word, being closed. So we used to run the masterclass in the hospital where the FND clinic was, but I guess now none of us are actually employed at that hospital anymore. So we're like, well, do I really want to give you the kudos then of having a masterclass for something where you're actually not willing to support our clinic anymore? So we as a team for now made the decision to run the masterclasses somewhere else in the future. And that's kind of going back 2 months ago. And we have the weekend for this year already booked in as well, but then this stupid coronavirus came in the way. So we will see. So the next masterclass is meant to be, I think, late July this year. But then with coronavirus, it might be delayed for this year. But yes, the team is as keen as ever. We're very keen to still run them. They will be done somewhere else in Brisbane. And if and when I will, as soon as we have any news, I will send something through to you, Bridget, so you can share the information.
That would be great. And a couple of the other things that we're looking at, some of them are just comments. And I think this is a comment, but I think if we kind of look at it as a question too, is when you mentioned about the GPs and what was their incentive, someone has commented and said that they should go back and look at their Hippocratic oath. Where do you think that line is? Because I think all those are very valid points, and I think it's also important to mention how you mentioned that there needs to be a platform for medical professionals to voice that, because if we don't know what their thoughts are, then we don't know how to look at the situation and tackle it. So I think that's great that you've created that environment for them.
Look, with the Hippocratic Oath, I very much agree with that, and it frustrates the hell out of me as well. But I think we need to, so for us as the FND community, we need to accept the real world. And the real world that most doctors are well-meaning, but most doctors at the end, particularly in things like GP practices, essentially they're private businesses. And the real world is, at the end of the day, it needs to be viable for them and sustainable from a business point of view as well. And that for those businesses is very hard. In a public hospital setting, I think that's easier because you don't have that pressure to make money because you just get a salary. But I think we need to accept in the real world, a general practitioner out there runs a private business, and there's a few real stellar, outstanding people that are willing to give and willing to have reductions in their incomes. But if we want this to be recognized and treated better as a whole by large groups of patients, I do think we can't ignore that.
Absolutely. Yeah. And another question that feeds right into this is, do you have suggestions on how to approach a new physician and increase those chances of having a positive interaction? Because I do think that there are things that we can do on both sides. And, especially the time I've heard that repeatedly come up. And as we all know, the amount of symptoms that's kind of inevitable. However, patients can be ready with their questions. They can prepare beforehand and maybe prioritize, what symptoms that they need to speak with first, or what are some other tips or suggestions that you would have?
I think, being well prepared is super important. So for me, when I have patients, I guess my Germanness comes in there as well. I like to be well organized. So I guess this kind of comes in my nature as well. But being prepared for your appointments makes such a difference. So rather than when you see the doctor finally got in there and he starts going through history, then being like, oh, I'm not quite sure anymore, can't find it anywhere. I guess gets everyone agitated and burns unnecessary time that you can use better. So I think if you can really prepare well, I love it when patients come in with things in writing, and I love it when they even come in with printouts and I'm like, okay, this is for you to keep, Alex. I don't want it back out. Great. So I don't have to type it all down. I can just use that and fill in a few bits in between. So be structured, be well organized. And for me, some doctors might not like it. I love it when patients come in with printed lists. And I heard beforehand from one of the people I spoke beforehand, timelines, those things for me, I find super helpful, particularly in those often complex stories. And I guess you want to get your story across as a patient as well. And you want to get it across correctly, not just some half, oh yeah, we got it roughly. So I think that's super helpful.
Great. I think those are all great tips. Question also, when you spoke regarding the clinic that you're running that had a wide spectrum of professionals, what all did that include? Who all was involved? And
yeah, so it's I guess that's something whenever we give talks about FND as well, I want to get across to other health professionals. It doesn't take all that much in terms of manpower and money, not as much as people think. So the core team I did one clinic a week, and we had our physiotherapist was at the end 3 physiotherapists, but combined they would have done 1.5 or 2 days a week for the FND service. And the psychologists, were 2 psychologists, they combined would have done 1.5 to 2 days a week. That really was the core team. And then we had a psychiatrist attached to the team who saw patients, but he was not regularly kind of part of the service, and occupational therapist and speech therapist, again, kind of more on an as needed basis. But really the core team was just those 3 groups. And with that, you can achieve a lot. So we managed to see between 80 and 100 patients a year with, what do you think are very little resources. It didn't cost that much, really.
wow, that's incredible. That's great to see. And then as far as the master class, were those all of them included in that master class?
I mean, for the teachers or for people who come as participants?
Actually, both.
Yeah, so for teachers, the whole team is there now. So we have grown since then again as well. So we've got a fantastic FND nurse. So, and because that's the other thing as well, for the master classes, I guess just the way we've grown as well, when we had nurses coming, they're like, oh, that's all great. You tell us all these things about you fancy neurologists and what the psychologists do. But me, as a nurse, in my tertiary center, at the cold front line, we've got these really tricky patients. No one tells me how to deal with that. There was an issue as well. And that's, again, we live in the real world. These are issues and people are scared of that and people need guidance. Thank God we have a fantastic nurse who joined the team probably 3 or 4 years ago. So we have one of our nurses who actually works on the ward, really can share his knowledge, which really helps as well. So we've got 1 nurse, 3 physios now doing teaching, 2 psychologists, 2 psychiatrists, and myself. That's the teaching team.
That's absolutely
fantastic. In terms of people who come, and I share a secret, well, probably not so much of a secret with all the people listening in, but some secret. So we have a long wait list actually for the masterclass, but the wait list is not strict. So for me, because what we discussed beforehand, any GP who applies to come to the masterclass, I fast track them because I'm so desperate to get more GPs interested and involved. And any neurologist who applies for the same reason, I'm getting them straight in because those 2 groups really need to boost more and get those people involved more.
That's fantastic. Another question goes back to, would you advise someone who is struggling to get support and medical advice to go privately?
I don't want to talk people into spending money, okay? So, and I can share you honestly my thoughts about what I do and for our situation here. So for me privately now, I hope I can help my patients I see privately. And the nice thing is privately, I have time. So every patient gets minimum 1 hour for a new review. So we have a lot of time to talk about these things. And the nice thing is privately, I can pick exactly who to, from FND Help to all patients. Do I reply to that, our OTs, doctors?
we'll get it if.
Okay. I hope I can help these patients. The nice thing is there's some benefits to the private system. I can pick exactly who to refer to. So we have a fantastic network of interested people in FND in Brisbane. So I can say, okay, I want you to see this psychologist and this physiotherapist. And with them, we work very closely. That can work very well. But the truth is, it costs money. And for the top end of town, believe it or not, they get FND as well. That's fine. They can afford that. And for them, paying some money out of pocket, that's not an issue. But I've got some patients, they can't even afford the bus ticket to come in to see me. They're never going to be able to afford that. And then, do you really want to kind of remortgage your house? Do you really want to borrow money somewhere to go privately? That's a tough gig. So I think at the moment, in Australia, I can only speak for Australia, private certainly in many areas is a good option because sadly, publicly, those things haven't developed because we just cannot get the support yet across Australia for good public services. So at the moment, sadly, I think the answer often has to be yes, because the public services are not there. In the mid to long term, we need to get public services off the ground for patients who can't afford to go private.
Absolutely. And some of that's going to change given the country that you're in and some of those options that are available. Of course, in America,
yes, absolutely. Yeah.
It's all paid.
And if you speak for Australia, I understand, of course. Well,
yeah. But there's definitely, to access care is always important. And unfortunately, it's not always accessible when it's needed.
With therapy, one of the real issues I see publicly with at least how the system is Australia, in my experience, generic services don't work well at all. So when you see, let's say, well-meaning neurologist or GP sees a patient with FND, and they're like, oh, yeah, we just do random physio referral, random psychology referral, it generally doesn't cut it. So then seeing some random physio, never heard of FND in his or her life, that doesn't help anyone. It just only gets you frustrated, gets the patient frustrated, doesn't help anyone. That is a real issue in the public service, I think.
And that's one thing I think that they have found, especially in physiotherapy, some of the work that Glenn Nielsen has done. Also, Catherine Lefevre does the MORE program that they've been trying to educate, because unless it is a specific program.
Absolutely.
Now, I don't know, are physiotherapists tend to be doctors in Australia or?
No, so physios and OTs are, some of them have doctorates if they've done research, but they're not doctors here.
But they're not, and same with occupational therapists, correct? Okay. Another question that someone has is regarding to asking why you think that doctors typically just give out a website. And that was a common theme that we've heard through patients that feel frustrated that they got a link to a website and that's it, no explanation.
I see the same thing in Australia.
Yeah, we do have a photo of you with our patient booklet. So
yes, exactly. So I see. I think for me, it's one step at least of progress we made compared to bugger off. There's nothing wrong with you. So at least we've come one step. Many steps to go still, by all means. But I think it's exactly those issues I raised beforehand. I think one is time pressure. Second one is they are scared. None of us have learned how to diagnose FND, first of all, in med school. None of us have learned how to discuss these diagnoses. And people are scared. People are scared of those discussions, and that's just the truth. Doctors are really scared about raising those discussions. I don't know. Well, I guess I know why. I think we should do better, but that's the real truth. Where at the moment, for the majority of people, best you can get is like, oh, you got this FND thing. Here's a website. Off you go again. So I think, again, with that, education. I see huge interest. Like for us, wherever we are, people, health professionals, they want to know more. They want to learn more. They know they don't do patients justice at the moment. They know they don't do a good enough job inside. But none of them learned any better, which is a problem. So in some ways, I guess we need to realize it as well and do better. So for me, really, that's now a starting point. We need to get into med schools, start there. We need to get into physiotherapy training, into nursing training. That's where we need to get in. So once those people come through out of training, they're like, FND, totally got this. I've completely got this. I've got this covered. I'm not scared of it. I know what it is. I know general treatment principles. That's how we're going to make a change. We need to get in real early training.
Absolutely. I've in a different experience because I've had the opportunity to sit in some of these discussions where we do just put everything on the table and the doctors are open and can discuss some of those fears. And I was really surprised when the first times, one of the most confident doctors that I greatly respect, one of the first things he said was like, let's face it, you guys, these patients scare us to death. And I was just shocked to be able to
Totally.
hear that and
Totally.
for him to be real, and it was very validating for the other medical professionals because they all agreed. They all felt.
I'm glad he was honest, but that's the truth. I'll give you one anecdote as well, similar to that. So when I did my training here in Brisbane, I had amazing training, had a fantastic mentor, but he was one of those old gurus of movement disorders. Like people would be sent from far and wide to be seen by him to do his kind of check patients out. And so that's actually when my interest started in FND. So we're doing movement disorder clinics, and in between, like this amazing figure of authority. And in between, he was like, oh, Alex, that's a patient for you. You see that one, and for God's sake, don't bring them back. I'm like, what is that? And well, as it turns out, then they are patients with FND. He literally, positively was scared of those patients. So this massive figure of authority. When he saw patient with FND, you could see the angst in his eyes. You could see he was actually freaking out, didn't know what to do. That's the truth. And that's what we have to work on.
And I think it's helpful for patients to understand that medical professionals are human too.
Yeah.
There are some that are FND aware, that we like to say, that are confident, that they do understand the diagnosis. We don't want to leave everyone, I guess, with that impression that there's not some medical professionals out there that feel confident. But that group that typically are showing some of those biases, that it really does come down to them feeling like that they don't have the answers that they, and most do want to help. There's some that aren't nice, but I think for the most part, they came into to help and they want to help. And so as patients, I think one of the girls even mentioned it, Rachel, that give your doctor the benefit of the doubt when you're starting a new patient. Maybe you've had some bad experiences in the past. Let that doctor start with a clean slate. Have respect just as much as you want them to go there with you.
Well, and I think what we need to accept as well, attitudes generally take time to change. Like a lot of that is peer group, and don't want to excuse those old guys. But if you imagine if all your working life you've been taught, oh, these are just time wasters, these are just patients, they're mad, they're banging it on, all these things, and then now we come along, we're like, no, hang on guys, let's change this. It takes time, and attitudes amongst teams. I still see that now. When I walk into rooms and then other doctors talk and they're like, oh, Alex is in the room, Mom. We're not allowed to say that anymore. I'm like, oh, God, it takes time.
I think a prime example is when we discussed actually the other day about the nuances of the brain and mind and how we've gone through all these years of looking at them separately when we know that they're one. And those older medical professionals, they know that the brain and mind is one. That's kind of it's become very common. However, we still like to put mental health and, psychology, neurology in separate boxes. And with FND, we're not only shifting the FND paradigm, we're shifting the way the world looks at the brain. And we force that in FND. And it does, it takes time, but we're doing it and you're doing it. And we really appreciate the work that you've done. It's fantastic. And thank you so much for the topic that you chose to speak about. That was brilliant. Thank you.
Pleasure. Thanks for having me. It was great.
Thank you. And we've come to the end of our FND conference. We're really excited the way that it turned out. Thank you for our attendees for being working with us, our panelists for working with us. It's kind of just been thrown together here and there as we tried to work on it. We'd also like to thank our IMAB, which is our International Medical Advisory Board, that have helped our organization throughout the years. That consists of Professor John Stone, Dr. Catherine Lefevre, Dr. Alex Len, who you just heard from, also Dr. Tim Nicholson, and Dr. Mark Edwards. And so we really appreciate all the work that they do to help our organization to move forward. I also want to give a little shout out to Dee, our events manager in the background. She has been doing an enormous amount of work to make sure that we had a fantastic awareness month. And so we really want to thank her for all the work that she has done. Again, thank you to Ashley and Rachel and Haley for the amazing job they did, youth. It's really quite historical to have a group of young girls come on, talk about the illness and advocate. That hasn't happened before. So we're really excited that they came and shared that with us, and what an amazing group of girls that they are. Thank you, Dr. Afra Moenter, for her discussion today and going through her program that she does. And again, we just want to thank everybody for joining us, and we appreciate all that you do. Please tune in to FND Hope, our YouTube channel. We will have everything on there eventually from the past 3 days. And thank you for joining us.